I've seen a lot of posts on social media lately, which are really disheartening, and it's patients expressing that they don't feel like doctors are doing their job, meaning the patient felt rushed through a clinic encounter, or they didn't feel like they were getting the information they needed or deserved. And I thought that it was important that you hear a doctor's perspective. So first off, I'm sorry that you had that experience. I've been a patient myself, and I know how frustrating it can be if you feel like you're not getting the time and attention you need and deserve. But here's the challenge. Insurance companies continue to decrease their reimbursements to hospitals, which means that hospitals are getting paid less for doing the same amount of work. This is especially challenging for academic centers like where I work at, where we also take care of uninsured individuals. So if we're getting paid less, the hospital can't be in debt. So what do? They ask the healthcare providers, the doctors, the mid-levels, the nurses, to just do more. Not get paid more, just do more. See more patients, do more surgeries, because that's how they're going to recoup that benefit. What that means is that I have to see more patients in clinic. In order to get a patient prepared for surgery, I'm seeing them usually at least twice, if not more, before surgery. And then I follow them for months, if not years after surgery. So you can imagine how just doing 1 or 2 more surgeries a month really increases my clinic volume. But we're not hiring more people to help with this. We can't if we're not getting reimbursed. So that just means that there's more work for us to do. So what can you do as a patient? First off, I think that messages like that undercut the doctor-patient relationship. If you feel like you're not getting the time and attention you need or deserve from your doctor, tell your doctor that. And if they're still not respecting it, get a different doctor. But I can tell you, I work with amazing doctors, mid-levels, and nurses, and we are all trying our best. We are taking care of cancer patients, so we're trying to get you into surgery when you need surgery. I'm trying to do those breast cancer revision cases in a timely fashion to avoid you getting into that next year's deductible, which we talked about in my last insurance video. So please, once again, let's keep this line of communication open, but I think that messages where one party is blaming the other and not really thinking about who's truly to blame for this is just undercutting the really important doctor-patient relationship. Let me know your thoughts in the comments below.